CEAL is a national collaborative whose mission is to advance the well-being of the people who live and work in assisted living through research, practice, and policy. CEAL has a 20-year history which began when the U.S. Senate Special Committee on Aging convened a work group to develop recommendations due to concerns about quality in assisted living across the nation. It launched in 2003 as the first recommendation of the Assisted Living Workgroup report that was delivered to the U.S. Senate Special Committee on Aging to serve as a national collaborative to promote excellence in assisted living. Since that time, CEAL has been a leader in assisted living by promoting and disseminating evidence-based practices, educational materials, and resources, and by hosting meetings and other types of conferences to provide collaborative space for thought leaders to develop, discuss, and advocate for practice and policy recommendations. In 2023, CEAL became based at UNC Chapel Hill and now has additional capacity to develop, promote, and disseminate cutting-edge research and research findings. CEAL maintains the national collaborative that it's had ever since its onset and has an advisory board composed of numerous organizations. They include the Alzheimer's Association, American Assisted Living Nurses Association, AMDA, the Society for Post-Acute and Long-Term Care Medicine, and the other organizations you see here. CEAL also has a diverse and growing list of strategic advisors who represent many different organizations, ranging from universities to the National PACE Association, National Center for Health Statistics, ASPE, NASW, and a whole host of other organizations listed here. The work of CEAL is done through action-oriented cores that are based in consumer, policy, practice, and research. With CEAL moving to UNC in 2023, we're starting with a key initiative in each of our focus areas. In the area of public policy, we're developing material to promote evidence-based policy and to provide a forum for discussion, beginning with a comprehensive compilation of each state's transition plans, informing how they are being compliant with the CMS HCBS final rule related to community services and person-centered care planning. In relation to the area of practice, CEAL develops and disseminates resources across a wide range of topics, beginning now with a new one highlighted from a recent Washington Post piece, which talked about rising acuity in assisted living and the care needs of the assisted living residents. In this arena, CEAL is hosting the Be Well and AL Coalition, which is to promote the knowledge and uptake of new recommendations for medical and mental health care in assisted living. In terms of research, CEAL not only promotes and collaborates in research, but is driven to get research information into the hands of the people who really most need it. And for that, we are translating research for practice and policy. Here I'm going to read what you see in red because I think it says it most clearly. Thousands of research papers are published in academic journals about practices, policies, and outcomes in assisted living, but few of them are available to assisted living organizations, providers, staff, policymakers, advocates, educators, and residents and their families. The CEAL at UNC website compiles research published in academic journals along with the abstract that summarizes the results of the study. Beginning this year, we're adding a user-friendly "What This Means for You" section that will be added to each resource. So here's a screenshot of what a few of the publications from last year looked like. We hope that you'll visit our webpage so that you can access this information. In terms of moving forward, the future directions for CEAL at UNC are going to be informed by advisors and collaborators. One potential area is to focus on quality improvement, such as promoting the use of the toolkit for person-centeredness in assisted living. Another potential area is to focus on the workforce, partnering with organizations and states to develop and sustain high-quality direct care workforce efforts. And a third area is the emerging area of accreditation in assisted living. For example, building off of what's happening in North Carolina in their adult care home accreditation pilot project. And as my last slide, I want to recognize that with the launch of CEAL at UNC, we're using it to re-energize the efforts of CEAL and to expand the collaborations with new ones. And for that reason, I'm especially grateful to be able to be presenting at Direct Supply, because CEAL welcomes collaboration with all organizations to develop and bring evidence to inform practice and policy. Please visit us at our website and email us, and thank you again for inviting me to talk about CEAL with your group.